Assalamu alaikum. Dear colleagues, the purpose of triage is to pick up the patients of corona from the emergency. In the triage department, we see the symptoms of the patients. The main symptoms of corona are high grade fever, dry cough, and shortness of breath. The fever is usually with ricors and chills, and the cough is usually dry, and sometimes it is accompanied with hemoptysis. And the shortness of breath, we see that usually there is no history of asthma or seasonal allergy in these patients. The main symptom, the alarming symptom, is shortness of breath. In any patient where there is fever and shortness of breath, you can consider them for the PCR test. And you can send them for the PCR test in consultation with your seniors and the administration. The other symptoms of corona can be severe weakness, body aches, severe headache, and there can also be nausea, vomiting, and diarrhea. Sometimes it can present with the symptom of loss of smell, and it can also present with the heaviness in the chest. And sometimes the patient can present with severe chest pain, just like an MI. In that case, even the ECG will show you acute anterior wall MI. In that case, you must get the X-ray done and the CP done and the CPK. The CPK will be raised because in that case, in the corona, there is carditis, and because of the carditis, there can be TROP-T can be positive, but in X-ray you will find pneumonia. So all those patients who are presenting with chest pain, you must always consult your seniors in those cases. So the other symptoms I have told you, the patients who are coming without the symptoms of upper respiratory tract or fever, you can send them to the normal OPD. But in the normal OPD also, you should always treat every patient like a corona patient. You should keep a distance of 3 to 6 feet, and you should, if need to approach the patient for pulse or blood pressure, you should approach the patient from the side. And you should never be face to face with the patient. And then all those patients who are presenting in the emergency and they are stable and they are all right, but they are presenting with symptoms of upper respiratory tract like rhinorrhea, cough, fever, you can investigate them, and the relevant investigations are CP, ESR, CRP, and X-ray chest. And you can send them home on Panadol or paracetamol or acetaminophen. These are all the same. And you should not give them Brufen or Aranic. And you can even give them antibiotic if you feel like. And the preferred antibiotic is azithromycin. For all those patients who are presenting in triage center with upper respiratory tract like symptoms, you should tell them that they may have corona, and so you should ask them to quarantine themselves in a separate room, preferably have a separate bathroom, separate towel, separate bedding, separate utensils, and keep a distance of 3 to 6 feet with all the people at home, their children and especially their elderly, because the elderly are more prone to this infection. And they should keep this for 14 days. And during these 14 days, if any other person in their family or friends get the symptoms of upper respiratory tract in these times, he should or she should also be quarantined. Now, when you are attending the triage center, you should always keep yourself protected. Always put on your shield and your mask. And always keep a distance of 3 to 6 feet, not only with the patient, with all your colleagues and all at your home. And when you finish the job, you change your PPE and then go home, change all your clothes, better have a bath. And then when you wash your clothes, always use bleach. And you make sure when you are working at the triage center, the surfaces over there are rapidly and repeatedly cleaned with solution of bleach. This solution contains 1 part of bleach and 9 parts of water. We have also provided you with the spray bottles containing the disinfectant. You can disinfect your PPE, your shields, etc. with that solution. And while working here in the hospital, you should always protect yourself. You should have a good sleep, have a good diet, never come empty stomach to the ward, and keep yourself hydrated. Keep it up and have a good luck. Thank you.